All right, let's dive into a really common and super frustrating medical mystery, the so-called pinched nerve. Today, we're going to unravel why it can be so tricky to figure out what's really going on, and why for doctors, one test is almost never enough to solve the puzzle. You know that feeling, that sharp, shooting pain that zings down your arm, or maybe a weird numbness or weakness in your leg? These are those classic telltale signs that a nerve is getting irritated somewhere. But figuring out exactly what's happening and where, well, that's the absolute key to actually getting better.
Now, the official medical term for this whole situation is radiculopathy. All that means is that a nerve root, right where it branches off your spine, is getting squeezed or pinched or inflamed. The best way to think about it is like a kink in a garden hose. The water, or in this case the nerve signal, just can't get through properly. And that's what causes all those bizarre sensations down the line.
So here's how we're going to crack this case. First, we'll dig into the mystery itself. Then, we're going to meet our two lead detectives, the MRI and the EMG. We'll look at what each one is good at, how they work together, and finally, how all those clues lead to the right diagnosis.
So what makes diagnosing a pinched nerve so tough? Well, getting it right is everything, because that diagnosis dictates your entire treatment plan. If you get it wrong, you could end up with therapies that don't work, or even worse, procedures you never really needed. The problem is the symptoms can be kind of vague, and the anatomy in there is just incredibly complex.
To really get to the bottom of it, doctors bring in two key players. They're diagnostic detectives, the MRI and the EMG. And here's the thing, they don't look for the same clues at all. In fact, they have totally different jobs when it comes to finding the source of the problem.
And this slide just nails the difference. I love this analogy. Think of the MRI as the anatomist. It's taking a super detailed picture of your spine, asking the question, what does everything physically look like in there? The EMG, on the other hand, is the electrician. It doesn't care about pictures. It's testing your body's wiring, the nerves and muscles, to ask, how is it all working? Two totally different questions. Okay, let's start with our first detective, the MRI. That stands for magnetic resonance imaging. This thing is amazing. It gives us this incredible high-res picture of the spine. We're talking the bones, the discs between them, the nerve roots, the whole shebang. It's our structural blueprint.
So the MRI is just fantastic at seeing physical problems. It can show clear as day if you've got a disc that's bulging or herniated. It can spot a narrowing of the spinal canal, which is called stenosis. Basically, if something is physically pushing on a nerve, the MRI is going to see it.
But, and this is a huge but, the MRI is not the whole story. Its biggest weakness? It can find all sorts of abnormalities in people who feel perfectly fine. You could have a bulging disc on your MRI that has absolutely nothing to do with your pain. It shows you the structure, right? But it can't tell you if that structure is actually causing the problem. And that's where our second detective comes in, the EMG, or electromyography. Now, instead of taking a picture, the EMG is basically listening in on the electrical signals firing between your nerves and muscles. It's a functional test. Is the body's wiring working like it's supposed to?
The real superpower of the EMG is that it measures function. It can tell you if a nerve is actually misfiring because it's damaged, not just because something is touching it. It can even give you clues about how bad the problem is and how long it's been going on. And this is critical. It helps the doctor confirm exactly which nerve root is the culprit.
Of course, just like our MRI, the EMG has its own blind spots. Right after an injury, in that acute phase, an EMG might come back totally normal, even though there's a real problem. It can also sometimes struggle to pinpoint the exact level of an issue in the lower back. And for long-term problems, it can sometimes make things look worse than they actually are.
Okay, so we've got two detectives, each with a unique set of skills and unique weaknesses. The real magic happens when they team up and compare notes. And there was a fascinating study that looked at exactly this.
So get this. Researchers took a group of 170 patients, all of whom were suspected of having radiculopathy, a pinched nerve, and every single one of them got both an MRI and an EMG. The goal was pretty simple. See how often these two very different tests actually pointed to the same conclusion. And the results, they were really telling. What they found was that even for the most common problem areas in the neck and the lower back, the two tests only had fair agreement. And for other nerve roots, the agreement was even lower. The big takeaway is that these two detectives were frequently coming up with different suspects.
And this leads us straight to the study's main point, and honestly, the single most important idea of this entire explainer. EMG and MRI are not rivals. They're not competing to see which one is right. They are complementary tools. One shows the anatomy, the other shows the function. And you absolutely need both to get the full story.
Which brings us to the grand finale, putting all the clues together. A really skillful diagnosis isn't about picking one test over the other. It's about a doctor integrating all the evidence to build one complete picture that points to the best possible treatment.
And this is why it matters so much. If you rely only on the MRI, you might end up in surgery for a bulging disc that was never even causing your pain. If you rely only on the EMG, you might miss a major structural issue that desperately needs to be fixed. Using both is simply safer and way more effective.
So the ideal diagnostic journey really looks like this. It always starts with your doctor in a thorough clinical exam. That's step one. Then comes the MRI to get that structural blueprint. After that, the EMG to run the functional test on the wiring. And then, the most important part, the doctor puts all those pieces together to make the final integrated diagnosis.
You know, this combined approach is absolutely the gold standard for today. But it really makes you wonder, doesn't it? As our imaging technology gets sharper and our ability to test nerve function gets even more sensitive, what kind of new tools will the next generation of doctors have to solve these nerve mysteries even better?